Hello everyone, this is Jenny, and I decided on a whim to make a video that could potentially turn into a series. We'll see how this goes, about CHD, just congenital heart defects. Those of you who are my friends on Facebook have probably heard me talk about it many times and ask for donations and all sorts of things, and I appreciate everyone's support. Those of you who are not my friends on there and who have stumbled upon this through YouTube, awesome. I'm glad you found this. And I just kind of wanted to talk a little bit about what CHD is. It's almost February, and February 7th through the 14th is National CHD Awareness Week. So I kind of thought, in honor of that, I would do a video from a patient perspective. I find far too often everything I research, it's all medical, and it's mostly just doctors giving you medical jargon, and while that stuff is great, it's hard to identify with from a patient perspective. So I'll give you a brief overview of CHD and what my condition is. The rest is going to be kind of just me talking about my experience with it thus far. CHD is congenital heart defects. It's the #1 birth defect, and 1 in 100 babies are born with it. Congenital basically means from birth, so it's a heart defect that you're born with. Mine is pulmonary atresia with VSD. And I would say CHDs, there's a wide range of severity. You have something as simple as a VSD, which is just a hole between, or a hole in the heart, one place or another, whether it's in the top or the bottom half. Those are relatively easy to fix nowadays with the advancement of technology. Sorry I'm saying a lot. This is my first video, so I'm a bit nervous and I don't know how to speak like this. So, and then, it goes from something, like I said, as simple as, a VSD or ASD to something kind of like hypoplastic left heart syndrome, or what I have, pulmonary atresia, which is basically, if you know how the heart is, there's 4 chambers and there's 4 valves. The valve going from the right side of the heart to the lungs, the pulmonary valve, I was born without one. And I was also born with a hole between the bottom 2 halves of my heart. So essentially, I didn't have blood flow to my lungs when I was an infant. And I did, but it was coming from the left side of the heart. So everything had already been oxygenated. And basically the heart was doing double work. So my heart was overworked, and it just, didn't work quite right. And I've had, several surgeries as an infant, and then 2 different valve repairs since then. But enough medical awesomeness. Again, basically why I wanted to do this video is to bring a patient perspective, especially an adult patient perspective. Nowadays there's just as many adult congenital heart patients as there are infants or children, and that's amazing, but it's also incredibly scary because we're kind of the first in this generation. Doctors don't quite know how to deal with us, and that's scary as a patient. It's frustrating to go to the doctor and tell them your issues or concerns, and then basically not really know how to handle it because, again, we're the first that they're encountering like this. So it's frustrating. And another reason I want to do this video is just to reach out to others that may be in that situation, that you go to your doctor and you're like, oh, I'm short of breath, or I'm not able to do as much as I could, and the doctor is kind of like, I don't know what to do. And yeah, so this is basically for all of you guys, especially my Zipper sisters on Facebook. All of you have been wonderful support for me, and I know there's many of you in this situation, and we're all just frustrated, and I'm trying to, I guess, air that out for the world to know. So, yeah, that's just kind of the beginning of my story and what I wanted this video to be about. I'm sorry if it's rambled or been incoherent. Again, I'm very new to this. I'm hoping this is received pretty well, and if it does, then I'll try and make another video or so, just kind of giving an account of my daily life and how CHD affects it. I always try and stay really positive and see the bright side of things despite how my body doesn't want to keep up with life, but that's hard. You know, you try and be happy and just keep pushing, but it can be a huge struggle and disheartening when you see everyone else, you know, getting on with their life and having kids and all that, and you know, that's just not in the cards for me. That's a really hard thing to accept. So it's kind of some topics that I might look forward to talking about. If any of you have questions, suggestions, anything like that, that's where I'm hoping this will go. So thanks for listening and watching, everyone, and I hope you all enjoyed and have a good night. Bye.